We've been in lockdown for a month, watching the coronavirus crisis unfold on our screens. But the peak now reached. The lockdown can't go on forever. Decisions have to be made about how we come out of it and when. A global pandemic that shut down not just the UK but much of the world. Our crisis deeper than it needed to be.
What history will say, looking at the course of this pandemic so far, is that there was a big difference between the way Asian scientists view this and Western, British and American scientists. In the West, we tended to say this is a kind of like a very nasty flu, and basically there's nothing you can do to stop it spreading throughout the population until you get a vaccine. Whereas in Asia, they thought this is from the SARS family, it is a deadly virus and it has to be stopped at all costs.
The UK late to lockdown, according to this global health expert.
I was very alarmed on, I think it was March the 12th at the press conference when they said they were stopping testing of minor symptoms, stopping contact tracing, and also not making any movement in terms of stopping large events or even non-essential travel. At that point, it seemed they were following the flu playbook, which assumes that everyone will get it and it'll become endemic and you hope some kind of immunity builds up. We don't know if you have immunity for a few months, a few years, maybe none at all. These are just open questions. And so I think when you don't know, the best things to be precautionary and say we keep our case numbers low and contain it and get more information.
Differences in approaches early on. Now, as governments learn more about COVID-19, there's a new consensus. Managing it involves testing, tracing and isolating the disease. Wherever the government, the aim is the same. No one wants a second wave.
Look around the world and see the countries that have managed to exit the kind of very draconian lockdown that we have here. And they've all done it by replacing a blanket lockdown with a system where anyone who has COVID symptoms gets tested immediately. Anyone they've been in contact with also gets tested. Anyone who has it gets isolated and quarantined immediately. And that is really the only way, if you look around the world, that you can effectively and safely exit the kind of lockdown that we're in.
Safety the first priority, but there is time pressure too. Lockdown in itself is harmful to the economy, and the longer the shutdown, the worse the damage.
It's clearly the case that the economic consequences of the lockdown and of continuing the lockdown are staggeringly bad. We know that the economy is likely to shrink over the next 2 or 3 months more than it has essentially ever shrunk before.
And it's not just the economy that will suffer from a long lockdown, our health will too.
The real worry is people not going to their GP when they've got a lump in their breast, not getting smear tests done. And in my area, referrals under the 2-week cancer target are down by 3/4. So that could mean potentially we're missing 3/4 of the cancers that we would ordinarily have got.
We may well end up with a lot of additional health problems, a lot of additional deaths in the long run, which we won't be able to say that person was killed by the lockdown, but we will know statistically that many more people will suffer from chronic disease, suicide. And I do think that those things matter and really do need to be in what sounds like a very sort of brutal calculus. But I think we have to be rational and cold-blooded to some extent.
We've seen this tension between economy and health, and economists saying it's not such a big deal and health people saying we need the lockdowns. And this is the wrong debate we should be having. The economy affects lives. And if you want to get through this faster, the fastest way to do it is to keep numbers low. And so I feel like everyone wants the same thing, which is if you keep numbers low, you can reopen the economy, you can reopen society in a way that's safe because you can do test, trace, isolate techniques, which only work if you have a small number of cases.
If we get to a situation in which the health service begins to become overwhelmed, you immediately will have to get straight down to another severe lockdown, possibly even more severe than this one.
An outcome that must be avoided, but how does the government plan to do it? Does a proper scaled-up testing and tracing system have to be up and running before you're even countenance easing the lockdown? Do you intend to establish what you think is a tolerable level of community transmission, or is your aim to push daily new cases as low as possible to control the virus?
Both of those questions are are ultimately for politicians, because they are the big judgments. What I would say is that test, track and trace can, done effectively, can help to suppress the transmission in a way that allows you then to have lesser social distancing rules. And critically, test, track and trace works more effectively when the rate of new cases is lower.
We're a long way from normal. With no vaccine in sight for a year, perhaps ever, we have to learn to live with COVID-19. The government has worked hard to keep us locked down in order to protect the NHS. But soon they're going to have to try to convince us all that it's okay to come outside again to places like this. And that could prove difficult. People are scared. As one senior minister said to me, the messaging has been, stay at home and live, go outside and die. And now the government have to try to tilt that narrative. The cost of this crisis will be counted in both currency and lives. The question now for the government, how much can we afford? Beth Rigby, Sky News, Westminster.